So what is myofunctional therapy?
So myofunctional therapy is the identification and then the treatment of strengthening the oral facial muscles. When we're thinking sleep apnea, a lot of times people start to lose muscle strength in their palatal glossal area, or they don't have proper tongue function. So what's happening is they're laying on their back, their tongue flops backwards, blocks their airway. What we're doing is we're helping identify those issues and then helping strengthening those muscles.
Is there a trick you can tell my audience? What can they do to get the myofunctional therapy? You think of coffee.
Coffee's great as long as you're not sipping it throughout the whole day. That's what a lot of people do, right? They'll go to Starbucks and they take a sip here and a sip here. It's the worst thing you can do for your teeth, simply because, again, you're just introducing that acid attack over and over and over again. Your saliva gets exhausted and it can't keep up with it.
Mouthwashes with a lot of alcohol in them. There's a mouthwash in the market today that has over 40% proof alcohol, which is unbelievable. What is your thought process on alcohol mouthwashes?
We're taught that if a patient marks on their medical history that they have substance abuse, you cannot give them an alcohol-based mouthwash. Okay, so why are we giving this to anybody? You introduce something to anybody and you can get addicted to it, right? So yes, there is a strong alcohol content, and not only for our oral health, but our gut health. So what we're finding is that there's...
Today I have with me Stacy Wiseman.
She is an anti-dentist mindset, cavity-free coach, myofunctional therapy expert, and the president of the Tri-County Dental Hygienist Association of the California Dental Hygienists Association. True force from Temecula.
She's not just a regular RDH who's cleaning the teeth. She's actually taking care of patients the anti-dentist way. She is teaching people how simple things in mouth make them stay away from cavities. She is teaching about myofunctional therapies that are unknown to most dentists, and she's going the anti-dentist way so that you can get more educated and be the guru of your own wellness. So welcome Stacy Wiseman from Temecula. And she's given us the time today to be on our podcast. Welcome.
Yes, thank you for having me.
So we'll start with one simple thing, because for people who actually don't know, you're an RDH, which is a hygienist. When you go to a dental office, you see the hygienist right next to the dentist. And then you're also a myofunctional therapist. So what is myofunctional for my people, if you can tell them?
Sure, yeah. So a myofunctional therapist is someone who identifies and treats oral facial dysfunctions. So what we are looking for is different muscle compensations in the face, head, and neck, swallow patterns. So some of the things that we treat are those kids that might have a tongue thrust issue. And what we see is that sometimes they go through orthodontics and then they relapse, right? Because their muscles aren't being redesigned to fit those areas and where that restoration or that restorative orthodontics is being done. So their muscles are still making that compensation. We know that muscles in our face, head, and neck put a lot of pressure on our teeth, and it can change the way our face structures develop, and breathing, specifically mouth breathing, will do the same. We know that the structures in our face, head, neck, and mouth can change the way that we breathe.
So I hear about nasal breathing a lot nowadays. Everybody started to understand that God has given us noses right here, and you're supposed to be breathing from noses, not from your mouth. But I understand obesity is creating a lot of airway issues. What is the number one reason that, let's start from the beginning. Do you think orthodontics is something that kids should get?
I do believe so, and I think most of it is depending on the situation, right? Most with our diets, we're not chewing as much, so we're not developing those muscles as much, right? Kids nowadays, they have pouches for everything, right? And they're getting the nutrients that they need from those pouches. However, they're sucking it down. They're not chewing. And we need the act of chewing to help develop our mandible and our maxilla and the muscles that are going to support those structures as well. So a lot of it has to do with diet. We also have inflammatory diets too, right? So we see with the seed oils, we see with gluten and dairy often are going to enlarge kids' tonsils and adenoids, which is going to make it hard for them to breathe through their nose. If they can't breathe through their nose, they're going to compensate and breathe through their mouth, which again is going to change the structure of their skeleton and also their muscles in their face, head, and neck.
So, what is the right age kids should look into orthodontic treatment?
So the American Academy of Orthodontics recommends age 7. I sometimes am referring kids at age 3 to have a consult. If I notice that they have a lot of crowding, they have a high narrow palate. Now, not all orthodontists or dental providers are going to do something at that time. Sometimes they'll recommend just start with myofunctional therapy. But sometimes there's 3-year-olds that need palatal expansion to really have a good quality of life and be able to breathe.
Interesting. So, I've also seen a lot of people chewing some kind of a plastic to maybe make your muscles stronger, or maybe putting some kind of a plastic in their mouth so that they can keep their mouth open. What is the reason?
So the reason is to strengthen those facial muscles. And so we have to work synergistically together. And what we're finding is that a lot of people will compensate, whether they're talking or smiling, eating or drinking. And something that a myofunctional therapist does is help identify those things and then help give someone specific exercises to be able to strengthen them. And some of the tools that we use are something like you're talking about, like a myo munchie or tooth pillow is kind of one of the more popular ones, a myo brace. These are all silicone devices that you could use to help strengthen those oral facial muscles. It's also going to help promote a lip seal and give us proper tongue positioning, because we want our lips closed, tongue to the roof of our mouth, suction to the roof of our mouth, breathing through our nose. That's ideal oral rest posture.
And if somebody doesn't do that, how do you notice that? And if somebody keeps doing it, what are the negative things that can happen?
Yeah. So one of the things that we mostly see is what we call adenoid face, right? And we see this with kids developing. They kind of have a sunken in face. They have dark circles under their eye or venous pulling that we see because they are breathing through their mouth and not through their nose. They have that open mouth posture. They can't keep their lips tight together because they don't have a competent lip seal, or the muscles around their lips aren't strong enough to hold it together. Sometimes we see that with lip ties as well. Like there's little muscle attachments that attach to our cheeks, to our jaw, but also our tongue. There's what we call our lingual frenum, can also be tongue-tied or tight, and that can cause an issue for patients to get their tongue all the way to the roof of their mouth as well.
Very simple question. Do you know anything about oil pulling?
I do. I love oil pulling.
Do you think if somebody is doing oil pulling, not that I'm recommending it, if somebody is doing oil pulling, his facial muscles will be stronger and better?
Absolutely. So one of the things that I like to recommend as a myofunctional therapist is oil pulling, because we often give our clients something called a water swishing exercise. And if you can do something therapeutic as well as get that exercise done, why not use oil to do so?
And secondly, if these muscles are very tight, some people say that these became very tight because of over oil pulling, because they were using virgin coconut oil and they were told to oil pull for 20 minutes. And these were people who started oil pulling and all of a sudden they had TMJ issues. So what is your opinion on that? Do you think, why is this important to have these stronger?
Right. So, sometimes we find that they're too strong too in patients, right? So they're what we call our masseter muscles. And sometimes we find in patients that clench and grind their teeth, those muscles will actually be overactivated. And what we see a lot is those patients have a lot of airway dysfunction. So they have something like upper airway resistance or sleep apnea. And a lot of times what happens is at nighttime, when you're not getting proper oxygenation, your jaw automatically comes forward and grinds your teeth. So what we're trying to shift to in dentistry as well is not just throw a night guard on somebody that, has these symptoms of TMJ dysfunction. It could be that it's their sleep and they're not getting enough oxygen, and that's what's causing some of this tension and issues in their face, head, and neck as well.
So do you believe that night grinding is a big issue in adult age, or is it even a big issue in young age? Because
both, and we see it a lot. I saw it with my own kids, and that's one of the reasons I wanted to get into myofunctional therapy. I was told by my son's pedodontist that grinding's normal. Grinding's normal for this age. And honestly, that's what I was taught too in hygiene school. They're in a kind of that mixed dentition stage. They're going to start losing teeth. Grinding's normal. But there's then also the behavioral parts of it too. Think about, maybe when you had kids, and the lack of sleep that you were getting, you're a little more agitated. You can't focus as well. Our kids are displaying that too into ADHD-like symptoms, right? They're unable to focus at school. They're unable to sit still. And so a lot of kids are actually now, being diagnosed and treated, with sleep apnea as well. I just recently had a 4-year-old go through his second adenoid surgery and a tonsillectomy and can now breathe better, but now we still have to fix his oral facial posture because he's still breathing through his mouth. So, a lot of it has to do with structurally, but also functionally. We want to make sure that these kids are thriving, right?
like I normally don't hear dentists talking about sleep apnea or talking about all these other things. If dentists are not talking, who's supposed to be talking to
Exactly.
the patients?
So, in dentistry, we're in a really unique position because we're looking in people's mouths all day. And as long as you know the signs to look for, you can't unsee it. And that's what I would always tell other hygienists that I work with or the dentists that I work with. Like, once I took myofunctional therapy and really started learning how to identify these issues, I can't unsee it. And, almost every patient could benefit from something that's, in some degree of it. But a lot of people are now getting answers to their questions, right? Like I would have 30-year-old patients come in for a morning appointment with extremely high blood pressure, have a relatively healthy diet, but then I start asking them about their sleep. And that's kind of where the disconnect is. And then it pushes them to get a sleep study done with their primary care physician. And, some are then on a CPAP next time I see them.
And it helps?
And it helps. But, what we're finding is that in California here, we have a great company called the Breathe Institute with Dr. Zaghi. And he is running a lot of studies showing that even with CPAP use, when we add myofunctional therapy with that, we actually see better results with our patients.
So what is myofunctional therapy?
So myofunctional therapy is the identification and then the treatment of strengthening the oral facial muscles. And so when we're thinking sleep apnea, a lot of times people start to lose muscle strength in their palatal glossal area, or they don't have proper tongue function. So what's happening is they're laying on their back, their tongue flops backwards, blocks their airway. Or what's happening is they're heavy. Maybe they have more weight on them, and that pressure, from their heavy chest is kind of blocking their throat or their airway as well. So what we're doing is we're helping identify those issues and then helping strengthening those muscles.
That's what I've always heard, that whenever somebody's overweight, their tongue kind of blocks their airways and they can't breathe. That is the main cause of sleep apnea. And most people, 80% I hear, can't use a CPAP.
Right.
So they end up not using it. And once they lose weight, though, it goes away practically.
It can, yeah. So by having that less pressure, on our throat, head, and neck area, it can absolutely, help with someone's sleep apnea.
So is there a trick you can tell my audience that what can they do to get the myofunctional therapy?
Yeah.
What can they do at home? Is there any trick for that?
Sure. So they have to know what they need help with, right? So it's like going, and that's where myofunctional therapists come into. We put a program together and we can tell you X, Y, and Z, you want to do these exercises. So sure, you can go on YouTube and find tons of different myofunctional therapy exercises, but know what exercises you want, right? So when it comes specific to sleep apnea, or sleep, One, we want to make sure that our tongue can stay suction to the roof of our mouth. So a lot of people, they'll start with just having that awareness. So they'll rub their finger on the roof of their mouth to an area that's called your incisive papilla. And you want your tip of your tongue to touch that incisive papilla. And then eventually you want the middle part of your tongue to be in the middle of your palate. And then you want the posterior portion of your tongue to be at that palatal glossal area
So
of your
it's
palate.
almost like training them.
Exactly. So you're kind of like retraining the muscles. So making sure that your tongue is up, because also by having your tongue up in that palatal glossal area, we're activating the vagus nerve too. And we know that the vagus nerve is very important for our autonomic nervous system to get us out of that fight or flight. So for example, when you see kids sucking their thumb, a lot of times those kids maybe don't have a full tongue tie or fully ankylosed, but they might have what we call like a posterior tongue tie or a mid-tongue tie restriction. So they're getting their thumb in there to actually calm their nervous system. So that's why a lot of kids, it's hard for them to break that habit because it's very calming for them. And so we need to be able to identify these issues to help get parents to get their thumb out of their mouth, because it's also changing the shape of their palate too, which is then impacting their airway.
So it could be the stress that is making the kids automatically do that.
Right, because they can't get their tongue up there either, right? They can't, take a deep breath through their nose and relax themselves, right? Because when you close your mouth, take a deep breath, your tongue, if it's at proper oral rest position, it's going to stimulate that area. So
do you still practice hygiene
I do. I practice 1 day a week clinically.
clinically? And do you specialize in certain ways, or do you just do all the cleanings and everything?
So I work for a general dentist. One of my biggest things is I never wanted to be just a teeth cleaner, right? And so early on in my career, I started bridging the gap between nutrition. We're taught nutrition. We spend a semester on nutritional counseling specifically for dental
That's more
disease.
than medical
Right.
guys, for sure.
So, as dental hygienists, we are trained to do this and discuss this with our patients. And a lot of times as new grads, we kind of get out of school and we're like, okay, we need to make sure we polish every little bit of stain off their teeth and their tartar off their teeth. And then nutrition kind of goes out the window, right? Because we want to show the patient how they can clean their teeth at home, keep their oral care. But what I found was that a lot of my perio patients, I was seeing them relapse. I was seeing them not healing right. And then you get into women and their hormones and all those kind of things. And so once I started bridging the gap between oral health and nutrition, and that's really what I started my business on, was putting out nutritional counseling guides for dental professionals for them to start implementing it chairside, using teledentistry or different types of testing and things like that. And then as I became more educated, I'm like, wow, we really need to bring in that airway health portion of it too, because this is all so important with how we can stop disease in our mouth.
So give us like a 30-second idea of nutrition. What nutrition do you recommend?
Sure. So for my dental patients, a lot of them I talk about circadian rhythm eating. So men do well with fasting. So sometimes I'm recommending that for them to kind of reset. However, a lot of times with dentistry, what we're looking at is every time you introduce food into your mouth, it's dropping the pH of your mouth, right? So if you're constantly snacking, your saliva never has a chance to kind of catch up and help remineralize your teeth, right? Because if we have healthy saliva in our mouth, it's going to do its job, right? We're getting that calcium, we're getting the phosphate, everything it needs to help replenish the teeth and create hydroxyapatite, right? So what I usually recommend is for patients to kind of space their eating out. Maybe start your morning with breakfast, 7 a.m., and then eat 2 hours after that, eat maybe another 2 hours after that, 2 hours after that, and then you're done for the day. So usually I recommend, 3 full meals with a snack in between. Meals I like to have very nutrition dense. So what we're going to be recommending usually are some kind of protein in the morning. I usually stick to like a 40 30-30. So I want to make sure that my patients are getting a minimum of 40% protein in their diet, because a lot of people are under eating.
For people who may not understand what protein is,
Sure.
can you say eggs, or can you say
Sure.
a general diet plan for somebody listening to the podcast?
So like a general plan, what I put patients on would be Eggs, usually one whole egg and then maybe some extra egg whites to kind of increase that protein macronutrient count. And then maybe like an oatmeal or a sourdough toast with some avocado because I want them to have those healthy fats as well. Because usually in the morning I'm having them take like a D3, K2 to absorb, right? So we want them having a healthy fat when they're taking those fat-soluble vitamins as well so that they're working to their full potential. So morning, eggs, sourdough with some avocado, maybe some microgreens on there too.
What do you think of coffee?
So coffee's great as long as you're not sipping it throughout the whole day, and that's what a lot of people do, right? They'll go to Starbucks and they take a sip here and a sip here and a sip here.
Absolutely the worst thing anybody can do.
It's the worst thing you can do for your teeth, simply because, again, you're just introducing that acid attack over and over and over again. Your saliva gets exhausted and it can't keep up with it. So
What do you think of apple cider vinegar in the morning?
So I love that for digestive health, right? And a lot of us get away from that. The mouth is the start of the digestive tract. And so if we're able to cleanse that and get our body ready for it, it's a great thing. Now, again, we're not going to be sipping it because it's highly acidic. However, it is a good way to restart our digestive system.
I
and get
take
those
it
enzymes
every
started.
day. I take a spoon, but I mix it in like 10 ounces of water so that it's literally super diluted. Then I add a pinch, like not even a pinch, like 1/10 of a pinch of salt so that I can get my cortisol level down early morning.
Yep.
That's what I've been doing for a long time.
Yeah.
So what do you think of that?
I love that. Yeah. And some people, they'll do warm lemon water, anything, because I think too, we take for granted our cortisol, and our stress levels as well. We know overnight, that's when we're producing much cholesterol in our body as well. So, we know cholesterol kind of helps with our hormones. So if we have that imbalanced, when we wake up, we're not going to be as refreshed. We're not going to be as ready and energized to go throughout the day. So a lot of times people will use something to stimulate their digestive tract, like that in the morning to get their day started.
So since we were talking about hydroxyapatite, the big divide line in the sand nowadays is fluoride versus hydroxyapatite. Like personally, I'm not against fluoride in a toothpaste. But I'm not going to influence you. But I am against fluoride in water. But let's hear your opinion. Fluoride is still considered the gold standard. The dentists, 99% of them love it. Hydroxyapatite is gaining momentum. And based on your real patients, not ideology, have you seen better outcomes with one over the other? Give us a case where switching actually changed decay or sensitivity. I want real life situations like you would have encountered in your practice day to day.
Right. So, well, let me start. There is the difference between topical application of a medicament and systemic intake, right, of a medicament. What I'm seeing a lot now in clinical practice, and this could just be the area that I'm working in, but I'm seeing a lot of thyroid disorders, right? And so we do know that there are issues with fluoride and thyroid, right? And we could get all the research papers out on that too, that it impacts, our thyroid hormones, parathyroid, so on and so forth. So I think that fluoride still does have its place in dentistry. However, hydroxyapatite also can't be dismissed, right? Because we are seeing the studies that back the evidence that it works just as well as fluoride. Now, when fluoride remineralizes a tooth, it creates fluorapatite crystals, right, which is going to make our teeth less acid resistant. When we remineralize with hydroxyapatite, we're just putting that back onto the teeth. And one of the biggest things that I see with my clients and some of the things that they report to me is that their teeth are so much whiter after they start using hydroxyapatite. And then I explain to them, well, it's science, right? It's biology. So what hydroxyapatite is doing is it's filling in those little micro cracks or microfractures or little pits in our teeth. So then when the light shines off of it, it appears to be whiter because it's not it's a more consistent surface. So it's physics and chemistry and biology, right? It's as to how it works. Now, from a clinical standpoint, from what I've seen, and I've been maybe recommending hydroxyapatite for, gosh, I'm trying to think, 2021. was the first product
Which
that I
one do you
recommended.
use?
So right now I use Guru Nanda, but I also before that I was using Risewell. And so I use I love Risewell, and I recommend that toothpaste to a lot of my clients. However, what I found was that there are parents that are scared of fluoride. They're scared to give it to their kids. And so we need another option. One of the other options that we had was something called MI paste, and it's made with something called ACP. Now, it's a casein, and so if you have a dairy allergy, you can't use it. So I had this particular kid who had a dairy allergy. Mom didn't want fluoride, but had incipient caries, in their mouth. And I'm like, okay, well, this is a 10-year-old. Like, if once we drill a hole in that tooth, he's always going to have a filling in that tooth, right? Like, once you drill a hole, you're always going to need something there to replace it. So let's try this toothpaste and see if we can at least delay him needing a filling. And sure enough, he came in, I wanted to check him 3 months later, after I didn't want to wait the full 6 months, and the cavities were reversed, the incipient cavities. Now, cavities can, at a certain point, not be reversible, but these were all incipient lesions that we could see and identify on the x-rays. So that's when I became a believer in hydroxyapatite.
Beautiful, beautiful. So bleeding gums are a red flag, right?
Absolutely.
Not normal. How many patients were told bleeding gums were fine until you discovered something deeper? Give us a case where bleeding gums pointed to a systemic issue. Because back in India, when I was growing up, there was a TV ad that said, if you don't brush hard enough and if your gums don't bleed, that means you're not brushing good.
Hard enough.
So I kind of grew up back in the day with that kind of a mentality. Similarly, I've seen mouthwashes, and of course, in the 60s and 70s, they were the Surgeon General of United States used to be the spokesman for Camel cigarettes.
Yep.
So then there is mouthwashes with a lot of alcohol in them, over 25% alcohol sometimes. There's a mouthwash in the market today that has over 40% alcohol, proof alcohol, which is unbelievable. It's not that popular, but it's still there in big stores. Sure. What is your thought process on alcohol mouthwashes? Let's start with that, and then we'll come to the bleed. Let's start with the alcohol mouthwashes.
Sure. I'd love to start there. So I'm actually going to start there with when I was in dental hygiene school, right? And we're taught that if a patient marks on their medical history that they have substance abuse, you cannot give them an alcohol-based mouthwash, right? So that alone was like, okay, so why are we giving this to anybody, right? Because you introduce something to anybody and you can get addicted to it, right? So that's that. And then, later on I would see TV shows similar to like Intervention, right? And people would literally buy mouthwash over the counter and drink it, as alcoholics because their family would not second guess it. But yes, there is a strong alcohol content, and not only for our oral health, but our gut health. So what we're finding is that there's, some studies now being published that we need healthy bacteria in our mouth. We don't want to kill 99% of the germs in our mouth because we want that commensal bacteria to help us. And if we don't have it in our mouth, it can't help us, especially those bacteria that convert the nitrate to nitrous oxide, right? And there's a lot of data coming out and studies coming out with nitric oxide that we need it for our vascular health, right? And so if we're using a product that is killing all of that bacteria that is going to help our vascular health, then I don't want it in my mouth, and I don't want to recommend it to my patients either. And so a lot of my communication with patients is on that, right? Because again, in their mindset, they're taught, I need to kill 99% of those germs in my mouth if I don't want bad breath, if I don't want cavities, if I don't want gum disease, I need to kill everything. So it definitely is a conversion and a problem to have them try something different because they've been using a lot of these products for years. And, and I would go in and show them that, the tissue sloughing, in their oral mucosa from the high strength alcohol products, and, that they're still getting bleeding, they're getting gum recession because their tissue is thinning and so on and so forth. So I have for a long time been not recommending mouthwashes, not recommending alcohol-based mouthwashes for my patients.
So talking about brushing, personally, my dad used to make toothbrushes, and I still did not know that we have to use a soft brush till very late in the game. And I used to brush like nobody's business. So even though I brushed correctly, I think I had undertone stress that kind of showed up in my brushing habits. Plus, I did not pay that much attention that I, knowing everything about brushing, need to use a soft brush. I always used a medium brush. And practically now, with all the knowledge I have, I think it's criminal to sell a hard brush. And any retailer or any company selling it is not doing humanity a service. But I want your opinion as a hygienist, as a functional, myofunctional therapist. What is your opinion?
Sure. So they're going to continue to make those products if people keep buying them, right?
It's
So
almost
that's
like cigarettes.
right, exactly. So anything harmful, right? As long as there's consumers, they're going to continue to make them. And, for forever, we've been recommending soft or even extra soft toothbrushes, depending on patients' needs, right? If someone has cemental exposure, dentin exposure, we don't want them even using a soft toothbrush, to preserve those precious tooth structures that we can erode easily with even a soft toothbrush or certain products that someone's using. So I see a lot of people too that will use an electric toothbrush like a regular toothbrush, and the technique is totally different between the two. So I spend a lot of time like with patients going over brushing habits, because a lot of people again use what they were taught when they were kids into adulthood, which it's not going to be the same, right? We have different brushing techniques, and dental hygienists are taught this, right? We have what's called the modified bath technique, which is most patients who are adults are going to use. And it's not just scrubbing your teeth. You're slightly angling the toothbrush along the gum line, small little circles along the gum line, taking your time, not brushing fast, using the full 2 minutes to do so. But people will often use that technique with their electric toothbrush that they invest in as well. And I tell people, you're spending that money, so it does the work for you. So, so I always recommend a soft or even extra soft. And honestly, the butter on the gums toothbrush is like the best soft toothbrush that you can get on the market.
Have you used it?
I have used it. I use it. Been using it probably for the last 2 years. Yeah.
Do you recommend it?
Absolutely. Yeah, to my patients. And I will say that the patients that I give it to, they're always coming back and are like, "Do you have that toothbrush you gave me last time?" And so they're really excited about it because it's finally something that's comfortable for them to use, especially those patients that have gingival recession.
Interesting. And I personally, I do use my own manufactured butter on gums, but I still also continue to use floss fusion once in a while, so that I can get the double whammy effect. And once a week, I'll use the electric toothbrush as well. I have the liberty of having all three, but I do want to get the benefits of electric, but I still personally believe that I control my destiny better when I'm using a manual toothbrush, because I've seen that a lot of people overestimate electric toothbrushes just because their dentist said
Right.
that. The dentist also, like the alcohol mouthwashes, since we were talking about them, it says ADA approved. It says like the number one recommendation by dentists.
Right.
So what is all that? Why do dentists recommend all this alcohol mouthwashes when they still know that it's going to dry them
Right.
out?
Well, it's branding, right? And it's FDA approval. And a lot of products, you need a lot of money to get FDA approval from things, right? You know that as a business owner, making these care products, like to get that approval, it's hard, right? And but it funds it to be able to put it on a product. And I say, ask your hygienist about the products, right? We are kind of like your oral care preventative product expert. A lot of us are going to continuing education. We're going to different conferences and we're learning about some of the new and upcoming products that are being available. And I'm not saying that dentists don't do that, but there are, a lot of conferences geared towards hygienists just for new products that are coming out and, to be educated on what's going to be best for our patients and their specific needs.
And I think hygienists are really the most underutilized tool in the toolbox because dentists don't have time. They are busy drilling and filling so that they can pay for the rental offices. Hygienists, if you give them a little love, they'll teach you so much. It's unbelievable. So saliva, it's probably the most ignored diagnostic tool, I would say. Most people don't even know that saliva protects their teeth, and it's the number one remineralizing agent, if that. Can you share a case where low saliva or pH explained chronic decay and how correcting it changed everything?
Yeah, so I have a lot of cases like this, but I'm going to use one in particular. So there's a certain medical condition called Sojourner syndrome where someone is medically diagnosed with dry eyes, dry mouth, all the things, and it's super uncomfortable. These people will often get mouth ulcers and things like that. So it's hard to use products for them, right? Because there are some aggressive agents in products for them to use. They want to be able to take care of their teeth. And so this patient in particular was going through a full mouth reconstructive makeover. And so I was working for a cosmetic dentist outside of Philadelphia at the time. And all she begged me, was I just don't want to get any cavities under my restorative work. And I'm like, okay, well, we need to be careful of what products we're using too, right? Because we need to make sure that it's not scratching the porcelain. We want to make sure that we keep the longevity of it. We need to keep your gums healthy, so on and so forth. So, I spoke with her and I actually called her physician or her people that were working with her for her autoimmune condition. And I mentioned, what's her diet like? Is it okay if I give her some oral health recommendations, when it comes to her diet and nutrition? And they're like, yeah, no problem. And so what I recommended was to increase her zinc intake. We know that zinc can heavily affect our salivary production, and it can affect the quality of our saliva as well.
Really?
It can.
How does that help?
Yeah. So what it helps do is it helps stimulate the salivary glands, but it also helps protect them as well. So what it is doing is it's making our saliva a better quality, because what a lot of times is that these Sojourner's patients, they're just drinking a ton of water, right? And we know that it's not just water that's in our saliva that we need it to help. We need the calcium, we need the phosphate, we need, some magnesium in it, we need some salt too, to kind of bring it to that area. And so what we did is we increased her zinc in her diet, and we were starting to see a little more salivary production. And for her, not being able to have to take a sip of water before every time she needed to speak was kind of like a game changer for her. So again, just kind of like working with the physician and regulating her minerals was a big win for her to be able to help. And she still had sojourns, she still had the dry mouth, dry eyes, all the things, but it wasn't nearly as bad as it could have been if we weren't able to make some of those adjustments. So
No, that's new to me too. So thank you for teaching me something
of
today.
course.
But zinc, did you recommend zinc gluconate, zinc lactate, or was it like a zinc mouthwash? What did you recommend?
So what we did was we were putting zinc, or we were recommending like supplementing with zinc products. So
taking a pill of zinc, like a 50 milligrams or something like that.
Yep.
Gotcha.
And then again, just putting a meal plan together for her that just was higher in zinc, but also hydrating foods as well, right? So we know that carbohydrate, high fermentable carbohydrate foods are really sticky, right? And they're going to stick to our teeth, stick to our gums. And if you have dry mouth and you're not being able to eliminate that, it will increase your risk of cavities too.
Is it something like a bread?
Yep, something like bread, crackers, cookies, all those things. So
Goldfish crackers, which the kids eat.
goldfish are the worst for the kids. Yes, you heard it here. Do not give your kids goldfish. Yeah, I know. They are cavity causing little, and a lot of parents give them that because they think it's healthier, than giving them fruit snacks and things like that.
And I know that there's dry mouth in other patients as well, except the autoimmune conditions, especially with antidepressants and stuff. Can you shed a little bit more light on that?
Yeah.
Do you see such patients too?
Yeah, absolutely. I'm going to be lecturing on a course specifically on the top 5 prescribed medications in the U.S. And every single one of them, they're side effects are dry mouth, or xerostomia.
Can you tell us those 5 medications?
Yeah, so the ones that I'm speaking on, top 5 in the U.S. Number 1 is simvastatin. We have levothyroxine. We have lisinopril, and we have atorvastatin, and then we have an SSRI, which is
So can you
like
tell
Prozac.
us, is it high blood pressure,
Oh, yeah, sure.
high cholesterol? Can you give
Yeah.
us in easy
So-
terms? For
Yeah, no problem. Yeah, right. Because who knows their prescription medication that they're taking? Because usually it's the generic anyway. So the first one is going to be your statins, which is going to be your cholesterol reducing medication. Then next, the second most prescribed medication in the U.S. is a levothyroxine, which is a thyroid medication for specifically for hypothyroidism. And then we have our high blood pressure medications, which are beta blockers. And then we also have our diabetes medication, like our metformin. And then we also have, what's number 5?
The
5 was the
antidepressant.
SSRI, the antidepressants.
Got you. And also anti-allergics.
Oh, yeah. Yeah, the
Because
Claritins.
Claritin
Yep,
and
they're
all
going to dry
these.
your mouth out. Yeah. Basically, like if you're taking a prescription medication, one of the side effects are it's going to dry your mouth
Because
out.
especially whenever I get sick, and at times I've taken anti-allergic, and the result is I actually get more messed up.
Right.
So I've stopped taking them.
Right.
So,
because your
nasal
mouth is
washes,
so dry.
probably.
Yeah. The nasal saline rinses are the best.
Lifesavers.
Yes, absolutely.
I agree. So apart from that, is gum disease truly preventable? In your experience, is gum disease inevitable with age, or have you seen patients completely halt progression through lifestyle changes? Give me a success story and a failure, if possible.
Yeah, one of the things that I like to educate my patients on is the host response, right? If our body's healthy, we're not going to get disease, right? Whether it's the flu, whether it's illness, whatever or gum disease, as long as we keep our bodies healthy and keep them functioning the way that they should be, we won't get disease, And so what I usually recommend for my patients that say, I don't want gum disease, I don't want to get gingival recession, I often ask them, okay, like what medications are you on? How are you feeding yourself, right? And so a lot of my clients are kind of in that, midlife range. And so I'm seeing a lot of gingival recession. And I'll often ask them, like, have you ever been diagnosed with osteoporosis, osteopenia, things like that? Because the mouth is not detached from the rest of our body. And growing up, I mean, I'm 40 years old, and growing up, we were always told, like, oh, stay away from fat, right? Fat is not good, but we know we need it. We need it for our brain if we don't want dementia, right? Like, we need it for our overall health. We need it to absorb the fat-soluble vitamins, right? And so I go in a lot educating, my patients too. Okay, we need fat because guess what? You need vitamin D. You need vitamin K. If you want to help make your bones strong and your gums strong and your bone around your teeth strong, you need all those minerals too. And so a lot of times I often will go into those conversations with my clients and, say, okay, I see a little bit of recession starting. This is what we need to do, to help prevent this. As for reversal, usually those patients are being referred to a periodontist, so I might not be seeing them, afterwards if their disease is severe. But we are able to help stabilize patients, make sure the recession doesn't get any worse, by making sure that they're using the proper oral hygiene routine and making sure that their nutrition is on point.
So since you're talking about vitamins, let me tell you, so at least people know, the difference between a Risewell and a Boca and Guru Nanda product is not only they all have hydroxyapatite, the Guru Nanda actually we added neem, which is a long-term, tried and tested, selective antimicrobial, I would say.
But it's soothing too.
But it's soothing too. And secondly, we add arginine, which is a prebiotic. We also add very interesting other things like vitamin K2 and D3.
Yep.
And now people will say they're not taking it in, but in the mouth there is absorption. And your teeth, people don't know, are like your bones. So the calcium is going to the bones. So it was very well designed, and that's what I always
It's very thoughtful. Yes.
Yes.
No. And that's what I love about the product is that it has everything in there to be successful as a product.
Beautiful. So, apart from that, flossing, what do you think of flossing? How important is that? A lot of people don't think flossing is important. There are certain dentists who come and talk about flossing is not that important. Even on YouTube, there are very popular dentists like that. What do you think of that?
So I would rather have someone floss than brush their teeth. And this is why. For your overall health, right? We know that the bacteria that's going to cause issues in our brain or our gut or all those things, they don't like to be in our mouth. They like to be under our gum. They don't want oxygen, right? So they're what we call anaerobic. And so they're going to get down underneath that gum line and start causing disease and all the things. So if we're not adequately removing that, and we know that a toothbrush doesn't get in between the teeth underneath the gum line, so that's why we need floss. So that's why I tell my patients that they need to floss. And guess what? Floss and then smell it, and then you let me know if if you need to do it or not.
Now, a lot of people, even in today's 2026 day and age, do not brush twice a day. They only brush in the morning. If you had to choose between the two, morning and evening, what do you recommend? Or how important is it to brush twice a day?
Sure. So I always recommend twice a day brushing. However, for some people, right, whether it's kids, my dad, for example, like my dad only brushes his teeth once a day, but he brushes in the morning. I'm like, no, do it at nighttime. You're eating all those things all day. Get it out from in between your teeth, under the gum line, and then go to bed. Because we know that at nighttime when we're sleeping, and our nervous system isn't working well, we're not producing as much saliva. It's not cleansing the food off our teeth. It's not cleansing that bacteria off our teeth naturally. So we really need to make sure that before we go to bed, we're doing a really good job getting all that biofilm off our teeth. And
So did he listen to you?
He did not listen to me, no. 20 years of doing this, and he still doesn't listen to me.
I would tell you, it was so difficult for me to get my own family to start looking into oil pulling.
Yep.
Because being the number one oil pulling manufacturer and seller, I had hard time convincing my own family.
Yep.
It's just the change is always very difficult.
It is, absolutely.
Yeah. So the other thing is the advice you'll delete forever. If you could erase one piece of advice patients hear every day, something you've seen cause harm, what would it be? And give us a real example of why.
The biggest one, I have a couple, but I'm gonna think the biggest that's gonna have impact that I think on the audience is being diagnosed with a cavity or gum disease or whatever it might be, and them not sitting down and taking the time to figure out why, right? And just saying that you need a filling in the tooth, or oh, it's small enough, let's put more fluoride on it, or whatever it might be, right? We have so many different advances in dentistry right now, and with peptides and all kinds of different agents we can do to help remineralize teeth. But without finding the root causes of why these kids or adults are getting cavities, we're doing a disservice to them, because no product, if we can't balance everything out, no product in the world is going to be enough to really help them. So it's really starting from, the base, really getting to the root cause as to why they are having this dysbiosis in their mouth.
A lot of people in America do not know about tongue scraping. I grew up tongue scraping. What is your opinion on that?
I love tongue scraping. I remember learning about it in hygiene school. Can I tell a story?
Yes, please.
I think you'll like this story. So I was maybe 6 months out graduating from hygiene school, and I saw an older patient. He was 98 years old, and he was a man from India. And I asked him, I said, oh my gosh, you have no gingival recession? Like, he had a lot of wear on his teeth, but he had some stain. That was it. And I said, what is your home care like? Like, you have all your teeth. He even had his wisdom teeth in his mouth, right? Like, he had great dental arches. And so I'm like, what do you do? Like, I need to know your secret. And he's like, I chew on the willow branch. And I'm like, that's what you use for a toothbrush? And he's like, yeah. And I'm like, well, what kind of toothpaste do you use? He's like, I oil pull. So he was using a branch and oil pulling. And that was his home care. And I'm like,
And
well,
tongue
listen, keep doing
scraping?
what you're doing. And he was tongue scraping. Yes. And I was like, that's all that you're doing? And he's like, yeah. And I was like, well, you keep doing that. And
So my great-grandfather, not my grandfather, but my great-grandfather,
okay.
did exactly the same.
Same thing. Mm-hmm.
And he died in his 90s, and he had all his teeth intact.
Yep.
My grandfather lost a lot of his teeth because he was actually brushing,
Okay.
and he was tongue scraping off and on, not that much, and he was not brushing at night.
Gotcha.
And of course, floss, 90% of India didn't floss.
Right.
So, or 95, I would say.
Right.
So I think the habit of the great-grandfather was the best one till now. So do you have a website? I'll give you 30 seconds to talk about your website or Instagram page. How do people get in touch with you?
Sure. So to get in touch with me, you can find me at Stacy Wiseman _RDH on Instagram, or my website is thehygienistmom.com.
Beautiful. We're going to be putting those links for her so that you can reach out directly to her. She lives in beautiful Temecula, which is in California. And in case you needed more information, visit her website and put your comments in the comment section. We'll try to have her answer some, or we'll try to get an expert to answer them. Thank you so much.
Thank you. This was
Thank you.
amazing. Thank you
Thank
so
you.
much.